my name is Karen and we'll talk to you about the lymphatic filiasis. This next is generally known as elephantiasis, and you can see better in the next photo. This next is neglected tropical disease, and is the unique human infection caused by the transmission of parasites or the picketer of mosquitoes, and the infection is usually contracted of child and other persons. Is you cause obvious damage for the lymphatic system. It is cause permanent, or the snakes can you be eliminated by you interrupt the speak to infection through annual repetition for dermatology or other treatments. The symptoms, the lymphatic filiasis, can you see apathic, acute, and chronic forms. Most infection are you aspect and don't present external signs. These contribute transmission of parasites and they cause damage the lymphatic system and the kinks in the immune system. This sneaks the painful like diffusing manifestation of the disease in the lymphaderma, elephantiasis, and scrotal swelling. After cause permanent disability of the system immunology. These patients in the snakes I don't debility physical or mental, but his suffer progress in mental, social, and financial demandage contribute of the sigma of the poverty. Thank you for your attention.
Hello, my friends. I'm Braulio, and I'm going to talk about the Turner's syndrome. This is a syndrome that happens to the female gender during the pregnant, to the mother, or in when you're born. The signs and symptoms of this syndrome include the following: delayed growth, abstinence and growth spurts, and spec times in childhood. One of the most popular symptoms, it could vary, but one of them includes stunted growth, abstinence and growth spurts, and spec times of childhood, a significantly shorter adult height than expected for a female member of the family, sexual development that stalls during the adolescent years, early termination of menstrual cycles that it's not due to pregnancy, and one of these symptoms, or one of the symptoms, and the woman have inability to become pregnant, and it means they can not have children. This syndrome, there's not cure, but there's a treatment. It could happen to the boys too, but it's very strange that happened. One of a little physical characteristics of the Turner syndrome, it could be your neck is more bigger. It's bigger your neck. Your ears too. For example, in the case of the female gender, your boobs are a lot of are smaller than another one, and the nipples are in a lot of separation. You have a short finger in your hands and in your feet. Even the hands and the feet are more shorter, and
hello, my name is Adir, and I'm gonna talk about a medical anomaly. And this anomaly called diaphragmatic hernia. And what is the diaphragmatic hernia? This hernia is a birth defect in babies in which there is a hole in the diaphragm. The diaphragm is the large muscle that separates the chest from the abdomen. And the organs in the abdomen, such as the intestines, stomach, and liver, can move through the hole in the diaphragm and up into the baby's chest. And when an organ passes through the hole, it is called a hernia. And this hernia, or a diaphragmatic hernia, can prevent the baby lungs from fully developing, and thus cause breathing difficulties for the baby at birth. And incidence. Researchers don't know exactly how many babies a year are affected by this hernia, and however, one study estimated that about 1 in 4 or 5 million, approximately, is born with a diaphragmatic hernia every year. And about half of all newborns who have a diaphragmatic hernia also have other conditions, including birth defects of the brain, heart, or intestines. And the cause and risk factors. Although the cause of the diaphragmatic hernia in most babies are unknown, the researchers or scientists believe that some case of this condition might be caused by abnormalities in the baby's genes. A gene is a part of the DNA, and the people inherit one copy of each gene from their mother and one copy from their father. The genes that a person inherits from their parents can determine many things, such as the person's appearance and whether the person might have certain disease.
Hello everyone, my name is Reina, and today I'm going to be talking about a birth defect called club foot. First of all, what is a club foot? A club foot is a foot disorder in which the foot turns inward and downward at birth and remains tight in this position. It is a common birth disorder in children. It can range from mild and flexible to severe and rigid. The cause is not known, but the condition may be inherited. Risk factors include a family history of the disorder and being male. It occurs in about 1 per 100 births. One of both maybe can be affected, and the feet may not look the same. The club foot may turn inward and downward at birth. It may be rigid and resist being aligned, or it may be flexible. The calf muscles are likely smaller than normal and are underdeveloped. In some cases, the club foot can be corrected without surgery. Treatment consists in gentle massage and manipulation of the club foot to stretch the tissues that have contracted. The tendons, ligaments, and bones of a newborn are flexible and fairly easy to put in the correct position. A cast is then applied to keep the correction in place. The cast is removed and changed every week for about 7 or 8 weeks, or until the doctor feels that enough correction has been done. And surgery. In most babies with club foot, the Achilles tendon needs to be released or cut. This procedure is called tenotomy and may be done in the clinic without anesthesia. In this case, a medicine is used to numb the area, and may also be done in the operating room with a very thin scalpel while the child is under anesthesia. The tendon will heal and reattach within 2 to 3 weeks. Finally, after the last cast has been removed, the baby will be fed with a special splint. This splint will help to prevent relapse. It will be worn 23 hours a day for several months, and at night or during naps for another 2 to 4 years. It is very important to follow the treatment plan exactly as instructed. A recurrence can happen easily, even with treatment. If it recurs, additional surgeries may be needed.
Hello, my name is Vanessa, and I'm going to talk with you about teeth that explode. 200 years ago, a clergyman from Pennsylvania, United States, identified only as Reverend D.A., began to suffer from an excruciating toothache. Out of his mind with agony, he did all he could to ease the pain, running across his yard like an enraged animal, banging his head on the ground, and plunging his face into icy water. Unfortunately, all those attempts were in vain. The next morning, the clergyman was pacing his study, clutching his how, when suddenly a sharp snap, like a pistol shot, shattered his tooth to pieces, giving him instant relief. Strangely, the explosion of the priest canine was the beginning of an epidemic of tooth explosion that would eventually be reported in a dental journal under the catchy headline, "Tooth Explosion with Audibly Report." Apparently, one young woman's toothache ended dramatically when her sore tooth erupted so violently that she nearly knocked it out, leaving her dead for several weeks. What could have caused this dramatic explosion? Experts proposed numerous theories, ranging from sudden changes in temperature to the chemicals used in early healing. However, neither of these arguments was particularly convincing, which is why the case of the exploding teeth remains unsolved to this day.
Good afternoon. I'll be talking to you about the microcephaly. The microcephaly is a birth defect where the baby's head size is smaller than expected compared to the head size of babies of the same age and sex. Babies with microcephaly often have smaller brains that may not have developed properly. We have the severe microcephaly. The severe microcephaly is a more severe and extreme form of this condition, in which the baby's head is much smaller than expected. Severe microcephaly can occur when the baby's brain does not develop properly during the pregnancy, or when the brain begins to develop correctly but at some point during pregnancy damage occurs and the brain stops growing. In this case, we have other problems. The babies with microcephaly can have a range of additional problems, depending on how severe of the condition is. The microcephaly has been associated with the following problems. First, the seizures. Second, developmental delay, such as problems with speech and other developmental milestones, such as sitting, standing, or walking. Third, the intellectual disability, decrease the ability to learn and function in daily life. Fourth, problems with movement and balance. Fifth, feeding problems such as difficulty swallowing, the hearing loss, and eyesight problems. The cause of the microcephaly in most babies are unknown. Some babies have microcephaly because of change in their genes. Other causes of microcephaly, including the severe microcephaly, may include the following exposures during the pregnancy: severe malnutrition, that is a lack of nutrient or not eating enough, exposure to harmful substances such as alcohol, certain medications, or toxic chemicals, the interruption of blood flow of to the baby's brain during its developmental. The microcephaly is a lifelong condition. There is no cure or standard treatment for this case because the microcephaly can range from mild to severe. Treatment options vary as well. Babies with mild microcephaly often have no problems other than the small head size. These babies will need routine checkups to monitor their growth and development.
Blepharitis. It is the inflammation of the eyelids. It normally affects both eyes along the edges of the eyelids. It often occurs when the small oil glands near the base of the eyelashes become clogged, causing irritation and redness. There are several diseases and disorders that can cause blepharitis. In general, blepharitis is a chronic disorder that is not easy to treat. It can be uncomfortable and ghastly, but it usually does not cause permanent vision damage and is not contagious. Symptoms. The signs and symptoms of blepharitis are usually worse in the morning, for example, crying eyes, red eyes, sandy, burning, or seething sensation in the eyes, oil-looking eyelids, itchy eyelids, red and swollen eyelids, feeling of the seeing around the eyes, crusty eyelashes, blood eyelids, higher blink rate, sensitivity to light, and blurred vision that usually improves with blinking. And causes. The exact cause of blepharitis is unknown. It may be associated with one or more of the following: seborrheic dermatitis, dandruff of the scalp and eyebrows, infections, obstruction of or dysfunction of the sebaceous glands of the eyelids, rosacea, a skin disease characterized by facial redness, allergies, including allergic reactions to eye medications, contact lens solutions, or eye makeup, mites or lines in the eyelashes, and dry eyes.
Cyclopia is a rare congenital malformation incompatible with life, characterized by the presence of a single eye in a central position, secondary to a lower oligocencephaly. Cyclopia is of heterogeneous etiology with a prevalence of 1.05 in 100,000 births. Cyclopia is a complicated and rare form of oligocencephaly. This condition affects the way the front part of the brain divides while the fetus is developing. Some children with this condition have very few problems and significant brain function. But in cyclopia, the eye have not developed normal, nor has a nose. Instead of two eyes, babies born with it may have a single eye almost in the middle of the face, like the mythical Cyclops, and a malformation nose that is almost absent, and may be located above the eye, rather than below it. Most babies with cyclopia do not survive and may have other serious defects that will make survival difficult, including severely malformed hearts. One possible cause of cyclopia is a toxin found in the Veratrum californianum plant. This can be confused with hellebore, to which it is related. Hellebore is a common herbal treatment for mild discomfort in early pregnancy. It is absolutely essential that women do not use Veratrum californianum instead, as it does not interfere with the development and division of the frontal parts of the brain.
Hey, today I'm going to talk about progeria. Progeria is also known as Hutchinson-Gilford syndrome. It's a rare disease that involves the premature aging of children. It's a genetic disorder and symptoms appear in the first or second year of life. Currently, it's known that the affected gene is the LMNA protein, but the specific mechanism still doesn't fit. However, researchers are working hard to understand this disease, as they think that is the secret of how it's that we age and how we can reverse this process. In Mexico, there is only one child in the entire country registered with this disease, and his name is Angel. His estimated lifetime is 12 years. His joints are affected like those of an 80 years old person. He loses his hair every time he turns 1 year old. His organism deteriorates as if he had turned then more. The Progeria Research Foundation in Boston gives him the medication he needs, which costs approximately 60,000 pesos or $3,000 a month. Without this medicine, his quality of life will be very poor. He will have more pain and risk.